and what's going to happen with FME. First of all, I hope you agree that the anatomy doesn't change, right? Anatomy is anatomy, okay? That's why the FME is going to have problems. And I would tell you, I believe the FME is going to have more failures than custom MSEs.
Why is that?
Well, because you are using, look, we're talking about a commercial, a company who's going to develop the product and sell the product. Yes? Everyone's going to do it, right?
Yeah.
TMJ Dentist?
Yeah. I can just see it now on the website. I can see it now.
Yeah.
There's gonna be a tab at the top. It's gonna say
providers.
No. On the TMJ Dentist website, it's gonna say restorative dentistry. Then it's gonna say TMJ/sleep apnea. You're gonna click the tab, and it's gonna say AGA, ALF, Vivos, FME.
Look, joking aside, okay?
I know.
I work with TMJ Specialists because they are TMJ specialists and splints and that sort of thing. Sure. But some TMJ specialists also do sleep and do a lot of these things which I don't believe in. Okay, so hence the humor. Okay.
Yeah.
So
yeah,
the device is going to be much. Look, I mean, we don't have to talk about cost, but the device is going to be very much more costly. And much more difficult to place. Now compared to the custom MSC, so because I'm expanding skeletally, I sort of look again. Surgery to me is an art. So when I expand, I'm feeling the force, right? So I determine, okay, how much force to expand. So I tell the patients, that's why I watch the patient. I go, hey, this guy, the skull, and you can't turn too much. So I keep on, I keep tabs on them, right? How much do you turn? I'm sorry?
It's a dance.
It's a dance. How much do you turn your MSC? You know, how do you feel the force? Because is when you turn, is it affecting the sutures? Is it tilting the teeth out? Is it cheese wiring the screws? Is it bending the screws, tilting the screws? So the whole system is supporting it, right? Okay. So you may be turning too much, right? So what's going to happen? The teeth is sort of supporting it rather than the tabs, right?
Yeah.
Okay. So, but that's the way the expansion works. Then okay, that's the way expansion works. But I'm just going over how much do you turn? Is it different for you versus a 50-year-old? I mean, it's the same for everybody, right? I mean, it's the same.
Yeah. One turn a day.
One
good
turn
luck.
a day.
See you in a month. See you in a month.
Okay.
Right.
See you in a month. That's a problem.
Yeah. Okay. And I can tell you as a patient, you have no idea what that appliance is doing when you're turning it. You feel.
You have no idea.
Yeah.
And the person placed it has no idea.
Yeah.
I'm going to get a lot of hate mails, but what are you doing? That's my question. So why is custom MSC Marpie, I believe, is going to get you better result than FME? Because you have more rigidity. Okay. Yeah. But the placement, okay, you could say, okay, well, the screws are, better design, and where it's locking and blah blah blah, this and that, and we got 3D placement, this and that. But you cannot change the anatomy of the palate.
Right. What does it matter if the screws are locking and if they're bigger and fatter, if they're going through the same paper thin bone? No, I've honestly had a very hard time trying to understand all the hype around The
Everybody
FME.
and people are coming and say, "Oh, you know what? Look. I hope it works well. You know, it will be great if it works well. But I can tell you, it's going to be much harder to place. Okay.
Because it's bigger?
No, because you're going to place it. They have this jig, and then you're going to have to because it's going to be a lot harder to place. Okay.
Can you help me understand what the sales pitch even is of the FME? Like, try to steelman the FME for me, because I don't even know if I understand how it's trying to differentiate itself from the other expanders. My only understanding of it is that, okay, it's posteriorly placed. Fine. MSE was posteriorly placed too. That has problems because the bone is thin. It has no arms. Okay, fine. MSE had no arms. That has its own problems because there's less anchorage, and people ended up just adding arms so that they could get more anchorage. So what's different? I don't understand. It's
Uh,
bigger, it's fatter, it's more metal. Maybe the appliance is less likely to get distorted because it's a more robust structure, but doesn't that just mean it's going to rip through bone easier? I'm being sincere and trying to understand
yeah.
what's the promise.
Well, everyone focuses. Look, it's a slick design. Clearly, the company has fair amount of financial backup. They have engineered developing it. Okay, um, but you can change the anatomy, and you and how is the procedure done? I mean, people are thinking, "Oh, all I'm going to do is place this device and expand, and voila." That's not how things work.
Right. There's
Okay, but
always going to be a dance. No matter what the appliance is, there's always going to be a dance.
and
There should be.
and you see, and so that's why I try to explain on the ease. I mean, it's people think, oh, it's going to take you 15 minutes. No, it's just it's like cooking. Not that I'm a cook, but it's a procedure that everyone's a little different. I mean, it's like a painting. That's best I can describe it. Okay, um, so anyways,
So you're not buying stock in FME?
well, um, like I said, I hope it works, but I think they will have a lot of failures because you will not be able to just place the device and expand. Sure, you could. Look, that's what I'm doing with with MSE in patients, which I assess. Look, I take CT scans. I know everyone takes CT scans, but I study the CT scans closely before the surgery because I look at the bone thickness, the depth, where there's a lot of you know I put a lot into it.
But with respect to the FME, if it's not a custom appliance or even a customizable appliance, and they're committed to posterior placement, what's even the point of taking a CT if you're going to put it in the same place
Oh,
with the same TADs no matter
they're
what?
going to tell you where to put it.
They're going to tell you where to
They're going
put
to
it.
tell you, well, yeah, I mean, you have the option, I believe, of them telling you, you're going to look, this device is going to, my estimation is probably going to, if you have the 3D and all that stuff, first they have to make it out of titanium, okay, because they need to be MRI compatible. Just, okay. My estimation at the minimum is 5,000, if not $8,000 per device
In lab fees.
with 3Ds and whatever. Okay, that's because it is a company that's going to, it's a company, right? That's number one. Number two, you're going to have your person, your doctor, place it. It is not putting in 4 screws or 6 screws. You got to, it's more to it, right? And you have to do your piezo, or I hope, and depending on where the screw is, you want to be a little careful doing your piezo, right? So We'll see.
But how is it different than a custom Marpie then? If you're just getting custom TAD placement from the lab based on a CT scan, and it's just another titanium appliance that goes like this, how is it different than a Partners Dental custom Marpie that
That's why
Lipkin and Evans and
I
everyone is
believe
already?
it will not be as successful as Custom Marpie. Basically, it probably the same. I said it's probably the same. You're still going to have difficulty in posterior expansion. Obviously, theoretically, theoretically, placing on the palate and expand, it's a little higher than the TPD than the E's. So you'll say, yeah, no, it's better. Well, I mean, I know that. Okay, that's why in some patients, which I do MSC because it's better, but rare. I mean, they're uncommon. They're going to face the same problem as the custom Marpie and all that, no posterior expansion. And people's going to, well, you don't need posterior expansion. That's what people is going to say, or people are saying. You don't need posterior expansion.
No one is going to say that on my channel. I can tell you that.
Okay.
The hope in my channel is that this is somehow going to provide posterior expansion without without the without the ease release. Just in virtue of the appliance design, it's somehow going to utilize that thin bone back there to expand posteriorly, just in virtue of the appliance design. I don't get it. I don't
Well,
get it.
no. I mean, I agree with you.
Yeah. Yeah. Well, then we're on the same page, but certainly I can tell you the hype is through the roof for this expander. I mean, people are putting off treatment in hopes that this is going to somehow be like the Messiah. They should call it Messiah instead of FME.
Well, like I said, it's like I said, you're a connoisseur of nasal maxillary expansion, and so it's there are a lot that goes into it. Number one, the anatomy.
Yeah.
Number two, how it's released.
The release is critical.
Number three, how it's expanded. What method do you expand? And how you follow the expansion. So which I spelled out in how I do the operation.
Right. Yeah.
So,
The Facegenics Messiah expander.
well, by all means, use this for teenagers. That's more applicable. It's all about case selection, right? And that's what
Understood.
I see with the FME. Oh, geez, the company that you don't need it released. You just do this because we have 3D, we lock screws, isn't that? Look, the anatomy doesn't change, right?
Yeah.
But
Okay.
sometimes some patients, they have thicker bone. Okay, you could get better, and there are patients you could get better engagement, and it could work, but it's uncommon. Look, I hope that FME is successful because ideally you want better treatment. Okay,
Of course.
you want better expansion, but it's not the device design, it is the anatomy. It's the anatomy, and it's how you do the operation.